After those kind of key steps, you can build subsidy programs on top of your Medicaid and CHIP. So, not everyone's going to qualify for Medicaid and CHIP who needs help affording coverage, and a lot of states are doing that as well, not just your celebrity health reform states. Many states at this point are looking at connectors, employer pay-or-play, and individual mandates. Massachusetts is the only state at this point with a connector and an individual mandate. And I'll just say this, connectors really aren't meaningful if the private market that they exist in isn't highly regulated. You can't make a connector the only place where people can go for community-rated, guaranteed issue health products. They're also not meaningful if you don't have some very clear standards about what kind of coverage is available through a connector, what kind of benefits, and who's providing that coverage. Individual mandates are also not effective unless you've really evaluated, is affordable coverage, affordable, high-quality, comprehensive coverage really available in your state. Employer pay-or-play is definitely a direction to look at. Massachusetts and Vermont have both implemented pay-or-play type systems. The assessments that they are levying on employers who don't provide health benefits to their employees are relatively low. They don't represent the cost of actually covering employees. So hopefully that makes them compliant with ERISA. I think John's going to talk more about that, so I won't go into it. But you have to be very careful when you go into the employer pay-or-play system. So where does Colorado stand now? Right now, you cover parents in your Medicaid program up to 60% of poverty, and there are 18 states that have higher eligibility limits than Colorado. You cover kids up to 205% of poverty, and there are 24 states with higher eligibility limits for kids. In the private market, there was a bill passed last session, which is great. It's working toward phasing out medical underwriting in the small group market, which is really important. And you consider sole proprietors small groups. So a business owner who's on his own can get the coverage of a small group, which is also good. But there are obviously a lot of things you can do. A Medicaid or a CHIP expansion is a really good place to start because you're going to draw down federal dollars for that expansion. And it also reduces the number of uninsured. So when you want to build something on top of Medicaid and CHIP, some kind of subsidy, a connector, you have less uninsured to contend with. Kids is a really good group to target for any Medicaid or CHIP expansion. The CHIP reauthorization and new CMS rules notwithstanding, kids are a great place to start because they're politically popular and they're not as expensive to cover as adults. So Illinois and Pennsylvania implemented all kids expansions last year, and then this year they're looking at using their success in implementing those programs to propel forward a broader reform. So that's a great place to start. And I'll just mention quickly, any Medicaid or CHIP expansion that you do, you have to bring in some improvements to your enrollment and retention because you can't just raise eligibility guidelines and expect people to show up and enroll. It's not meaningful unless you're working on enrolling people as well. In the private market, you need to have guaranteed issue in the individual market or guaranteed availability of coverage. There are different ways to structure that, lots of different models, but that's crucial. Modified community rating